Hold on, here we go. Good evening. Thank you for joining us on Happy Hippie Me Wellness Wednesday. My name is Wendy Vaughn.
And I'm Peely Bailey.
And we are bringing you information on holistic health practices that have worked for us. And
so that we can help you, support you with your health practices. And we're all here learning together. We're here to develop a community of women who are wanting to live more healthy, more full and vital lives. And we want to do that as well. So we're hoping that this will resonate with you.
Yes, absolutely. I love that. Learn, live, lead. So, so tonight we're going to talk about some information about depression. And I think I'm going to let Peely take it from here and just kind of like listen in and interject. So go ahead and take it away.
Yeah. So Wendy and I, we talk pretty regularly now, which is awesome. And we were really thinking about what we wanted to bring to you all this evening. And one of the things that we want to make sure that we're always bringing is our authentic experience to this work, because it's not just about, giving you a lot of recipes and a lot of advice about health things for any other reason than, we really want to help and support women like ourselves. And so we really are speaking out of our own experiences and some of the things that we've learned along the journey. And I truly believe that the best leaders are those who have gone a little bit further down the path and can look back and say, hey, this is the way, come with me. And by no means do we at all think that we are experts. We just know that we love to take stock of the lessons that we've learned, and then we like to share it.
Yeah.
So that's what we're coming to talk about. And so one of the topics that we really felt strongly needed to be addressed as we're looking at health and holistic wellness and things like that is mental health and mood regulation. And one of those things that we have experienced in our lives, for me, I've experienced depression. And so we really want to jump into this topic of mental health and depression with two lenses. So the first lens is looking at how does it affect women? Okay, and so just overarching without thinking cultural or, without thinking of culture or race, we're thinking just women in general. How is depression affecting women? And the second area is how is depression affecting women of color, and particularly African American women. And so the first came up because I was struggling with depression, and I went to my primary care doctor. Well, actually, I had gone through a lot of primary care doctors. So let me just back up and give you my story. So even when I was in my 20s, I would have these periods where I would just feel really sad and just really, just kind of like a wet blanket had fallen on me sometimes. And the way it would really present for me would not be a lot of crying, but would be more irritation and irritability and a lot of anger. And so I didn't have any person telling me that, oh, that might be something that you need to get checked out. So I just that was just my pattern. Every couple of weeks, I would have these dips in my emotions. And then I got married, I moved, I did all the life changes in about the span of like a couple months. And then I had a baby. And so it was a few years after I had my son that my moods just really became extraordinarily big and And because my way of presenting depression or sadness is anger, my anger got really scary for me, scary for my husband. And so it was in a couples therapy session, honestly, that we started having this conversation about, well, what is it that causes you to have such huge reactions to such small things? And have you ever considered being checked out for postpartum depression? So that was the first window into someone mentioning, well, maybe you have depression. And at that time, I was ready to listen. I recognized that what was going on with me was something that felt very unmanageable, that felt a little bit scary for me, and that I needed some help. So I went to my primary care doctor, and I have always been, I was raised in a home where we used a lot of, natural herbal remedies. I'm looking at Wendy. I'm like, I can remember times when
peppermint tea.
Yes. I can remember times when we were sick and my mom made garlic tea with honey, literally cloves and cloves of garlic, and then crushed it up and honey, and then made you drink that. So the holistic remedies are great, but sometimes they don't taste good. And so, but that was the way I was raised. And then I was also raised in a very religious home where you didn't trust in man's medicine. You trusted in Jesus, and so that was also a prevalent thing in me. So when I went to the doctor to talk about postpartum depression, I had that kind of stigma coming in with it. And so I wanted to ask, my doctor at the time was also an acupuncturist and a Chinese medicine herbalist. So in addition to being an MD, so I was like, can we go the natural route? Can we look at herbs? Can we look at, and he was like, that's great. He prescribed me a bunch of herbs that I was supposed to take all the time. And I was still having the dips, the ups, the downs, the dips. So he left the practice and I had to see another doctor, and that doctor, referred me to a psychiatrist, and that psychiatrist didn't really talk to me she didn't talk to me like a person. She talked to me like, okay, I have a very fast turnaround here. And she never even looked up from her desk to look at me. It was just, tell me your things. Here's the prescription. Boom. Wow. And so I didn't really feel very confident that what she was prescribing to me was actually what I needed. So there was this just nagging feeling, I'm not really sure that this is, that she's really caring about my particular health issues. Right. So these are two big things that happen for women, or for African American women too. We go into medical facilities, medical professionals, and sometimes we feel as though we're not understood, we're not seen, or we're not really cared for. So it's just check the box. Here's the prescription. Go on your way. Mm-hmm. And so that was really hard for me. So anyway, let me get back to, so what ended up happening was I went from medication to medication to medication. This one had too many side effects. This one, I just didn't like the way it made me feel. And then finally, I ended up on one that I actually could be on for a while. So I was on it for a year, but in the back of my mind, I was thinking, I don't want to be on this for a long time. I don't want to be on this for a long time. So after a year of being on it, I felt amazing, and I felt like I could conquer the world. And I felt like, I didn't have the dips and the ups and the downs. And I was like, yes, now I can go back to my natural ways and I am going to be fine. and at the same time, I was using my yoga and my aromatherapy and all these other components and talk therapy together to help me with my mental health. Well, I got off the antidepressants, and it was a steady decline, right? That's what happened until, about the middle of the year. So 6 months later, and I'm back to this big ups, big downs, and just, again, that rage, that anger that would manifest. And so I had to really sit down and kind of have like a come to Jesus moment. Like, why do I have such a resistance to using a medication that might be helpful for me?
Sure.
And Wendy, you and I have talked about what are the things, like we've talked a lot, like we're definitely wanting to advance holistic medicine and other complementary modalities of healthcare, but we're not an all or nothing. Right? So, yeah, so that was, that's kind of my journey into depression. And then from there, I started looking at, okay, well, what is it that I can contribute to this conversation? Because I have struggled with wanting to be on antidepressants. I've done a big coming out moment, because when I came off the antidepressants, I did this whole blog on my website, and I was just like, I'm using the natural methods. Like, I had this book called Yoga for Depression, and I had my, essential oils Bible, where I was basically looking up all the oils that could help with depression, and they do help. But what's hard when you're in the throes of depression is you don't necessarily have the energy to do all the things to help lift you up, right? You may not feel like getting out of bed.
Right.
You may not feel like eating healthy foods. In fact, you may feel drawn to eating foods that will actually amplify and increase your depression. So I'm going to just jump into, in case for some of you who may not be so familiar with what depression is, we're going to talk a little bit about what the symptoms are. Right. And then we'll talk a little bit about the prevalence of depression among women in general. And then we'll look at the prevalence of depression among African American women. Sound good?
Really good.
Awesome. And Wendy, feel free to jump in here anytime that you
definitely feel. At some point in the depression definition, if you know offhand that difference between anxiety and depression, because there is a difference, and some people use them interchangeably.
Yeah. And so what we're going to do, I'm going to talk a little bit about depression, and then Wendy's going to talk about anxiety. Okay. So some of the symptoms for depression are having a persistent, sad, anxious, empty mood, can be with excessive crying, a reduced appetite, or an increased appetite. You might lose weight or you might gain weight. Okay, so that one's not really a good one to hang your hat on. Persistent physical symptoms that don't respond to treatment, such as headaches, digestive disorders, chronic pain. So that was a major one. That was actually one of the things that led me to going to the doctor over and over and over and over.
Wasn't it something with like I remember your leg, like when you couldn't wear high heels for a while.
I was in pain from like the base of my neck down to my tailbone. Like it just felt like it was on fire. I had pain in my feet just standing was hurting. My left hip, and I would go to the doctor and they just were like, we did the MRIs, we did the things, we don't see anything, and we could give you painkillers, but they're addictive. And I was just like, I'm not into that, so that's when I went to the chiropractor, I went to the acupuncturist. But the other thing I got was itching. I had this issue where I was itching over my entire body for months. For months. And I would go to the doctor and they couldn't see anything. And so really what we started to realize is that I had chronic inflammation, right? Because the itching is an inflammation issue. And what I've learned later on is that that inflammation was something going on with my gut. And okay, and then we're going to talk about the gut and depression in just a second. That's like my, that's my happy place. But anyway, so irritability and restlessness is another symptom. Decreased energy, fatigue, feeling slowed down, feelings of guilt, worthlessness, helplessness, hopelessness, pessimism. That's like women, right? Because we so often feel all of these things, and the media tells us you're not enough. You need to be sexier. You need to buy this thing in order to be more beautiful. You need to keep your man. You need to change yourself. All these things that
we're told. Do X, Y, Z to be a good mom.
To be a good mom. You're not like, so our society breeds that feeling of worthlessness, hopelessness, not enough. Also sleeping too much, loss of interest in things that once were of interest to you, loss of interest in sex, loss of interest in, any of the activities that you usually do, your hobbies, difficulty concentrating or remembering things or making decisions, okay? And then thoughts of death or suicide and suicide attempts. So these are, if you can check off, and I think it's like if you can check off 5 or more of these experiences, then they say, well, that's how they would characterize, they being the medical professionals, major depressive disorders. So now let's talk a little bit about, you said the differences, right? So what are the symptoms of anxiety? And I just pulled it up here from WebMD. So let's see. All right. Panic, fear, uneasiness, sleep problems, not being able to stay calm and still, cold, sweaty, numb and tingling hands or feet, shortness of breath. That's a major one. When you feel like your breath is stuck here in the upper rib cage in your upper torso, when you feel like all you can do is, that kind of breathing, that's a big one. Heart palpitations. Sometimes people end up in the hospital thinking they're having a heart attack because of their heart palpitations when they're having a serious panic attack. Dry mouth, nausea, tense muscles, dizziness. So these are some of the symptoms for anxiety. And I don't know, does that resonate with you, Wendy?
Absolutely. Anxiety, I always equated it with worry, the fear of something that hasn't actually happened. Mm-hmm. So, and everything you just said, absolutely.
Yeah. Mm-hmm. All right, so let's look a little bit at depression overall and among women. So there's a study in 2010 that said that the global annual prevalence of depression among women was 5.5% versus 3.2% with men. Okay, so for women, there's a 1.7 fold or 1.7 times more prevalence for women to be depressed than men. Mm. And this is looking at across cultures, across countries, across social economic lines, the same prevalence of depression with women was found. So then looking also, there's an age discrepancy. So women in the ages of childbearing years, so 14 to 25, a little bit older, that there is a higher prevalence of depression for women in that age group. Okay. Yeah, it's pretty crazy. So 1 out of 20 non-pregnant women of childbearing age experiences major depression. Okay. 1 out of 3 women of childbearing age are on antidepressants. Mm. And when I went to see my doctor, the 3rd time, I was trying to do it naturally. So I wanted to not be on the antidepressants. I wanted to be taking, herbs that were known to be as effective with depression. So like St. John's wort, ashwagandha root. And I was also really looking at what my vitamin intake was and all these things. I was trying to be very, I wanted to say strategic, but no, scientific. That's the word. I was trying to be very scientific with how I was going to help myself through the process. And I finally got to the point where I was like, okay, no, I just need to get back on the antidepressants. And the one that I really like, I'm not going to call it out, but like I've taken 3 different kinds. And the last one that I've taken is really, it's one that has really worked for me. And so that's the other thing that I want to stress to women out there who maybe have tried an antidepressant and they're like, the side effects, I'm not myself. Okay, so don't just stop at that one. Go back to your doctor and say, this one's not working for me, or I don't like the side effects that I'm having, and I want to try a different one. And then you work with your doctor on how many milligrams, what amount. You work with your doctor on the symptoms that you're having. Don't just go home and suffer in silence with the symptoms that you're having. One of them that I was taking gave me night sweats, like so bad that like my side of the bed would be soaking wet. And I don't sweat. Like, wow. I don't sweat when I'm working out and things like that. So
what about, would you recommend anything when they're changing from one to the other? Is there a tapering down process, or can they just stop the one that's not working and try another one?
So that is a question for their doctor.
Okay.
I don't give medical advice because I am not a doctor.
Well,
I just play one on TV. No, no. Yes, in my experience, and WebMD has told me that that there should be a stepping down process, but that process should be monitored by your doctor. Because with antidepressants going on to and coming off of, there has been seen a reoccurrence of some of those same symptoms that led you to be on the antidepressants, and then additionally maybe an amplification of those symptoms. Mm-hmm. So it's very important that you stay in contact with your doctor. And one of the things that happens when you're on the antidepressants is that you start to feel so good that then you're like, well, I don't need these anymore. And I literally have had that happen all 3 times that I've taken an antidepressant. Like I get to a point where I'm like, I'm good. I don't need you no more. And then it's not true. So, all right. So let's jump into the looking at antidepressants and looking at depression and the Black community and African Americans. Okay. So depression is actually huge among African Americans and particularly women. Mm-hmm. But because mental health is often stigmatized in the Black community, women who struggle don't often get the support that they need. They don't either seek it out or they are ridiculed for trying.
I was talking to my mom a long time ago. I'm mm-hmm. sure doesn't even remember this conversation, but we were getting on a freeway on ramp, and I was having some just conversation about feelings, and she was like, "Okay, well, don't start that white shit now."
No,
I'm just saying, but
so we can we can say the real thing.
But I'm just saying, like, talk about keep your Black pride.
Yeah, and that's something that can be passed on either very verbally or it's something that can be passed on just culturally. If nobody in my family has ever sought help for their mental health issues, then why should I? Maybe this is just normal. Maybe this is just how everybody is. So I, didn't even think that there was anything wrong with my ups and my dips and my ups and my dips, because I saw that growing up. I just figured, well, that's just part of the normal experience of being a woman. We're just cray, right? And but that's not true. And that's the message that I really feel passionate about bringing, is that it is not normal, nor is it something that we should allow to continue to be in the state of depression for the majority of our lives. And when I was talking to my doctor and I asked her, I was like, it just seems like there is an epidemic in women, and especially women who have had children, or women in their 30s and 40s, like just being 20s, 30s, 40s, just being depressed. And she said, yeah, we in the medical community, we're calling it an epidemic. She's like, most of my female patients are struggling with either depression or anxiety. What does that say about our society? What does that say about the way that we're living if a huge percentage of women are struggling with this? So back specifically to the Black community, there was a study published by the Centers for Disease Control, the CDC, and they found that women, 4% versus 2.7% of men, and African Americans, 4%, are significantly more likely to report major depression than white Americans. Okay, so 4% versus 3% with white Americans. But the CDC also finds that 7.6% of African Americans sought treatment for depression, compared to 13.6% of the general population. So there's a higher number of the general population that's going for treatment versus in the African American community, where they are not. And what are some of your thoughts on that, Wendy? Like, in your own experience?
When I hear that stat too, because of the stigma, we have to keep in mind when people are reporting, if they're being honest when they're reporting.
Exactly.
So it could be even higher than that 4%. I think just being Black in America in particular, especially at this time, and it's been, I think that there's a lot of different things that so pervasively sink into our ism that you won't necessarily realize affects you until it just does.
Right.
And I mean, you can either be too Black, you could be not Black enough, and I'm saying these things not to like try to bring a race thing or anything like that, but your identity and everything that makes you matters. There's a class I had at UC San Diego that was called Politics of Our Bodies. So when you walk into a room, before you say, hello, my name is anything, you've already spoken volumes to the room, just based on the fact that you're a woman, that you're a Black woman, that you're a skinny Black woman, or, a gay white man, or a gay Asian man. Like, that's what they mean when they say politics of your body. And they talked about the different jeopardies that women carry and the different jeopardies that minorities carry, just on the simple fact that their skin is darker.
Yeah.
And, so when you think about that, and then think about that we live in a society that, as Peely talked about, the marketing and stuff and what we see, especially if you don't grow up in an area where there are a lot of Black people. Right now, I have the pleasure of working at a university where there's a lot of Latino people, from different Chicano or different places in Latin America. And so they don't have that feeling of alienation because there's a nice, healthy population. They might experience other things, but they do feel very connected to their culture, and like there's, a strength there.
Mm-hmm.
But when it comes to, you know, different areas that you may grow up in LA, where there are not very many Black people, you know, there's these things that can set into your psyche, and that
Yeah.
can make you just feel different, and you
Mm-hmm.
don't know why. So I can definitely see that being something that, you know, all people of color, especially Black people and especially Black women, have to deal with, and Black women in particular, because they are very intelligent. They're degree seekers. They are higher
Mm-hmm.
education. They are money earners, and I don't think that our male counterparts, have necessarily um, gone after those same types of things. And I think it has shifted the balance of who the breadwinners are in some of these families.
Mm-hmm.
That role reversal, which is something that, hey, women are strong and they can do a lot of the same things that men can do. Men can do a lot of the same things that women can do. But we still live in a society that wants to see a man bringing home the bacon and the woman making dinner, taking care of the kids. You know what I'm saying?
And I think that that's one of the reasons why, like, this is my own theorizing, that women, you know, of this day and age, who are of the childbearing years and who have children, are feeling so much pressure. It's because there is still that pressure of being a good mom. Also, if you decide that you want to be a contributing earner to your family, you want to be a full-time worker, or maybe you have your own business, and so you're trying to manage that. In addition to that, you're supposed to be, you know, this good wife that's there to support your husband, and then on top of that, you're supposed to be there to support the members of your, you know, your extended family, your in-laws, your community, you know, any kinds of community organizations that you might be a part of. You're always tapped to come help. So your plate is full.
Mm-hmm.
And we still have this idea that we're supposed to be able to balance everything. And that if I was a good enough whatever, a good enough woman, a good enough mom, a good enough wife, a good enough, you know, CEO, a good enough business owner, a good enough, all these things, I would be able to balance all the pieces of my life perfectly. Like, who's my guy that I love? Actually, Cat in the Hat wasn't able to do it, was he? He tried. I have a 5-year-old, y'all, so my book references are picture books. But Cat in the Hat wasn't able to do it, right? He was trying to balance everything,
Yeah.
and it fell. And that's the reality. Like, even as, you know, I've just really been sitting with myself when I have that internal monologue that's saying, oh, you're not spending enough time with your son on homework, or you're not spending enough time, you know, with your husband, you're not spending enough time, you know, with your mom, or whatever the things are, that you're just not enough.
You know what ended up happening? You end up getting the Girlfriend's Guide to Divorce. For those of you who caught that show on Bravo, it turns into this there was another author. So you had the one author who was like super mom, who did everything, the perfect wife and all this stuff. And then she started to die down because this other author came out that was like, forget it, mommy needs a drink. Like, she was more she was the Cardi B of like the mom of moms, right? But I think a part of it was that it was liberating. I think that's what people like Cardi B,
Right.
because she's liberating and she's saying, look, this is what I want to do. This is who I am. If you don't like it, don't follow me. And
Mm-hmm.
a lot of people are nervous to really claim that type of freedom, because it means that you're going to cut yourself off from some of your support systems. Probably some people who you do care about are going to be not so happy with you, and and that's a hard, scary place to go sometimes. But
Right.
yeah, so we try to juggle all these things at the risk of really hurting ourselves, and it doesn't seem like it at first.
Mm-hmm.
This amalgamation of energy that kind of just gets kind of like dumped.
Yep.
Not keeping your commitments to yourself. We talked about this in our last video. Over time, that starts to really get like the anger that I think also some of that anger, what I've noticed is that when I always take it back, because I believe in the one-on-one alignment, like everyone can be against you, but if you're aligned within yourself and you're not allowing that energy to seep out, that guilt and all that, if you know that you're a good person, that you're enough and you're doing what you need to do, all of a sudden you start to feel really strong and resolute in you,
Yeah.
in who you are.
Yeah.
So you can tell somebody else, look, without being upset about it too, because that's one of the things I'm working on. I've understand, like now I understand boundaries and the hard no that needed to come out, because before I was a people pleaser. I didn't want to make anyone mad, and oh, okay, I'll go. And bam, crumbs. Not playing. But anyway, not playing though. That's what
No, I know you're not playing,
you know.
because the body keeps the score. The body keeps the score. If you are not addressing the mental and emotional wounds that you have had, your body will manifest that in some form, fashion, or the other. Okay, so for some people, it's they overeat, they have a weight problem, they find their comfort in food, or they just can't seem to feel full, right? Because they have to keep pouring in for whatever reason, and that's how they're medicating. For other people, it's they have to be the reverse. They're always exercising. They're always on the treadmill. They're always, go, 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 go. They can't stop. For other people, it results in chronic itching through their entire body where there doesn't seem to be any cause. No allergens, no, you know what I mean? Like, or chronic pain. I remember I went to go see a neuromuscular, I forgot what her title is, but basically I can't call her a massage therapist, even though she is, because what she does is more like therapy. Okay. So you come in with whatever pain. So let's just say I went in for a left hip pain, and she, will kind of start talking to you as she's, uh, manipulating you. And then she'll say, like, at one point she's like, okay, so you're having pain in your left hip, and she's just kind of like rubbing it. And then she's like, yeah, so, tell me who in your life is a pain in your butt. Right? And instantly the person that I was thinking of came to mind. Will not say it out loud, but and so it ended up being like this crazy therapy session where she's just like working on my hip, and I'm just talking and I'm just letting it out. And then the pain lessened. So now what I've learned is, because a lot of times when we're in pain, our natural tendency towards pain is just to stop it. However we can, stop it. And move away from it. So, my hip hurts. Let's not touch it. Let's not move it. Let's lay on the other side, like everything away from the pain. And what I learned in one of my meditation classes that I really enjoyed was, instead of moving away from the pain, move into the pain. Experience the pain. Feel the quality of the pain. Where is it located? Turn it into a meditation. And what I found when I've done that, where I can just breathe, put my hand on the area of the pain and breathe into it, is that insights will come as to what that pain is stemming from. Also, that pain might move from that area. Once I've really just dialed into it, all of a sudden it just dissipates and it's gone. And then maybe I might feel, a crick in my neck. Okay, so now I'm going to go over to this crick in my neck. What is it that you want to tell me? What is it that you're trying to communicate? And that is what that whole one alignment that you're talking about, really getting in touch with, how am I feeling? What am I thinking? How am I feeling? How am I being? and just kind of going through those check places and seeing, okay, something is off, something is not aligned. And so really, I credit going through depression. I credit, needing to really take stock of where am I emotionally, taking my emotional temperature, with being able to go a little bit deeper inside and developing a self-awareness. And none of the other modalities that I use to support myself have been lost. The yoga, the breathing, the meditation, those are huge. You remember that session we had when we were doing the yoga and put you on the chair, and we did chair shoulder stand. So your hips are supported on the chair and your shoulders were on blankets on the floor. So that is actually a pose that is prescribed for depression. Additionally, poses that can be prescribed for depression will be chest openers, back bends.
And that makes so much sense, because oftentimes the parts that aren't connected when we're feeling really low is the second chakra, which is the sacral chakra, and then our heart chakra.
Yep.
Because those two things get disconnected. Think about heartbreak. Think about any betrayal that had ever happened, right?
Yeah.
Oh my gosh, that's so interesting that you say that.
So there's a lot to be said on depression. I think we just wanted to really shine a light on the subject, and I'm sure we will be talking about this again, and definitely bringing some tools.
Definitely bringing tools. I think this first one was really awesome, Peely. I like the fact that you shared your story and that you gave us a really good foundation into what it looked like, and the fact that so many people are dealing with it, and so many women of color, to really try to take that stigma away.
Yes.
I know that helping the self is probably one of the most, it's like the first real sign of visible self-love to me. And we talk about that. Visible self-love for self is visible self-love for everybody else. Or not self-love, but visible love for everybody else. Or even compassion. Yeah. And the word help can automatically have a bad stigma, especially if you're a perfectionist or a recovering perfectionist like myself. What ends up happening when you hear the word help, it means that you weren't doing it right?
Yeah.
And so that's a hard nut to swallow if you're over here trying to make sure that, you're doing everything in your power, and it can be tough. So I'm happy that this video addressed everything that it did. And definitely, if there are any questions for Peely or myself, any essential oils or yoga poses that, have helped her, please let us know. You can find us on Instagram at Happy Hippie Me, and that's hippie, HIPPY. Okay, Happy Hippie Me, and or you can find her at essentialyogaspace.com.
essentialyogaspace.com. And I definitely, as we're talking, I'm thinking we should definitely do a follow-up video to this with a yoga session, a little bit of just like the yoga poses that we do for our mood, and also using some of the tools that we have with our aromatherapy and some meditation. So yeah, we're gonna put that together for you guys, because I think that would be super helpful
and fun. So all right, guys, thank you so much for joining us tonight. We really appreciate your time, your eyeballs, your ears. We know they could be any and everywhere. Until next Wednesday, have a wonderful week. This is Wendy signing off,
and this is Peely Bailey. And if you like what you're seeing, please hit the subscribe now button so that you'll always know when we post a new video.
Thank you very much. Have a wonderful night.